right? Anyway, I just want to acknowledge my lens because I have this information about sexuality, but I'm this white woman from a middle class upbringing, currently middle class, have this heterosexual relationship with the child, although, not necessarily fully that route in life. So what I know and my experience is through that lens, right? I've done tons of education, self-education about different cultures and different subcultures and how sexuality is viewed in those different cultures and subcultures. And so I will not make any blanket statements about how things are in general for people with their bodies or their relationships or their feelings. So I'm going to try to keep it as generalized as possible. Take the pieces that make sense. Okay. So you both were talking about, you specifically, about menopause and aging and grieving, right? And when you go through cancer, especially, like a few of you, it's like this, where all of a sudden you're menopause, and so you're grieving that change in life, and then you're also grieving like the cancer. So, and I know this has been a long time for a lot of y'all, but so I think first off, it's important to acknowledge that it's a change, and it is one of many changes in and of course there's a lot of different parts that menopause affects your body, your mind, your emotions, your energy levels, but it also affects your sexuality and your sex drive. Most people have a lower libido with perimenopause than in menopause, but it's just a change. It's a change, just like maybe if you had any kids, how all of a sudden your libido changes because you're thinking about your child and not your partner. It's a change, but we've got to grieve it. So I see, especially in the cancer world, I see a lot of people around sexuality who have not really felt the grief around and the fear and all the things that come up with their cancer. And there's that kind of gets stuck in your body, right? So, and then that can manifest as pain, pelvic pain, that can manifest as just a lack of being able to sense pleasure at all. So, what I would say to start with is this is a change in life, or will be for some of us. I would say I'm perimenopausal too. Things are definitely changing, but it's on the slower end versus you had to go through it like that. It's a change. How do we grieve it? So what we had will never be the same. So what do? You can actually take some time by yourself, go lay down in your bed and just touch your body. And how does it feel emotionally when you touch your body? The differences, the changes that have come up. Like you're going to feel probably frustrated, angry. Why does this have to happen? Sad. But it's hard to just kind of stimulate those emotions without kind of pushing yourself that way for some people, not for me, some people. And so you lay down, you touch your body, and all people are staying out, you're by yourself. And I'm not talking about sexually necessarily, but just feel wherever, and whatever comes up, let it out. So tears, cry. You might notice a place, even me saying this right now, just check in and see if you feel tight anywhere. Like it might feel uncomfortable. You might feel tension here. You might feel like right here. Notice where there's tension. See if you can notice that spot. Just noticing that tension, that discomfort in your body can make your emotions come out. Also see if you can soften it. Sometimes when I get really upset, I actually did this once with a patient. It wasn't y'all, but I was doing lymphedema therapy on their back, luckily, because they were facing the other way, and I was going through a lot that day. And I just started to touch my own chest because that's where I feel my tension. And I was doing my thing on her, and then on me, I was touching my chest and trying to soften and breathe through it. Okay. So step one, grieve what's changed. Yeah. And then Step 2 is let's change the lens. So we're seeing ourselves, let's reframe. So reframing the sexual shift towards empowerment, towards the ability to do something different with your relationship, if you have one, towards expansion, life giving, being with yourself in a different way. So, how though? Well, I want to talk first actually about the wisdom. So, you were saying, and I don't know if you are open to sharing, but about like the thing that you went through with body image and how you just realized that this body is different, but there's wisdom here, right? Can you share anything about that?
So yeah, I was going through after cancer. I've been struggling to accept my body because it did change pretty fast, and I was having imposter syndrome because I'm here to empower women, and I'm sitting here struggling so much, and like guilt, shame, for all these things. So then the shift came. I said it came probably about when we went to Brazil, and I don't know. There was just a shift, and I just looked at myself in the mirror, and I looked at it from outside, like disassociated perspective, and I was like, she's pretty cool. I like her. She's kind of cute. I like her hair. You know, she has a pretty smile, and I would just like it was like a different because I was always saying the things, you're beautiful. Just love yourself. You're beautiful, and it's just like I don't care what you say from the outside. If I have this perspective of myself, it wasn't working out. And so I just started like changing the way that I saw myself and just accepting like truly accepting my body. And I think on top of that, I did go to several funerals. And I was just like, there's just enough. Like, is this how I'm going to live the rest of my life? But I had to disassociate and I had to look at myself as a friend with kind eyes because I would never talk that way ever. And so I just started shifting. Then the weight started coming off, the way I showed up, energy showed up differently, the way that maybe I interacted with my husband and other people. It just shifted, and I just did this self. I've been doing this self acceptance thing where I'm sharing more of my story too, from a vulnerable, just telling my story online and saying, hey, I was not very kind to myself, and I'm not doing this for pity. I'm doing this to empower you to know that I too go through this. Because from the outside, they're like, really? You seem confident. But you can put a mask on any day and night, and then you go home and you're like being trashy to yourself, the way that you talk to yourself. So to me, that shifted. And you have given me a lot of books to read. That one book, Body, the one with the black lady.
Yes. Oh, that reminds me. I've got some. Yes.
I call
Oh my
mine.
God. The body is not an apology.
The body's not an apology. That's
Yeah.
a really, really good book.
I forgot. I have a list of things.
That's a really good book. But I read that, but it still took time past me working with it.
Yeah,
It took a while.
definitely.
Even me, I was working with a nutritionist, and I would self sabotage myself because she would tell me, well, "Why did you do that?" Because I wanted to eat the donuts. That's why I did it. Yeah. And then I would go, and because I didn't look at my body in a way, I was like, "Well, I already ate one. Let me eat 12." I mean, I'm serious. I would literally go to Drummer Donuts, and that would be the story. And I was just like sabotaging myself until I just accepted my body.
Mm-hmm.
That's when I changed. I've lost this December.
Yeah.
But I mean, it's still in the making, and it's just loving my body where it's at. And it was hard. She sees me. It's just a yo-yo thing, but I know Nina's just like, I don't understand what's wrong. And I'm like, it's just a thing. I don't know how to get out of it. I'm trying to get out of it. And there's a law of momentum. You keep going, but there's also a law of momentum that as you elevate, you get exhausted because your mind is trying to keep you small and comfortable where you were. But you have to know, have that self awareness to know you have to keep through it. But sometimes you're like, I just need a rest. Give yourself grace. To me, grace sometimes.
For
For me,
someone
it
for
was.
someone who does
For me, that
constantly works and does always is pushing, that makes sense.
yeah.
Yeah.
So, you know how we all see When you see, how first time I met you 8 years ago, when you look at that picture versus yourself now, you just said, what does it do for you when you see those pictures? Before, I was trying to be that person. Like, when am I going to get back to that person? I'm not well until I get back to looking like that person and to being that fit person. So, I was very fit. I was smaller, I was fit, and I was always comparing my current self to, I won't be happy until I'm that pant size, until I look this way, until my hair looks this way. I have curly hair now. Like, everything's just changed. And that was destroying me. I needed to grieve that old version of me and let her go. Because that's just like a chapter. Like, okay, she's still a part of my life, but that ship has sailed. Close that chapter. And then, like, this new level, next level version of me, who is she? And how can I just but like, why am I constantly? But it was new to me to even go through a struggle of body image issues because I'm a confident person normally. So that was all new to me, and I'm sitting here telling all of you, you. Like,
But see, and so that's the wisdom I'm talking about. Because when you go through the change, well, obviously, menopause is one of many changes, but when you go through any change that's hard, then you all of a sudden have this perspective that is wisdom, and that's people who've gone through menopause are wise. So why are we not talking about that? Like, which is why it's helpful actually to have people on the internet and Instagram talking about menopause all of a sudden. I'm like, is it because I'm perimenopausal that I'm seeing menopause stuff? Oh, I think it is a social shift though, a little bit, right? Yeah. Okay. And so thank God, right? Because like it's been hush hush for so long, and it's not. Yes, exactly. And there in other cultures that's seen as a wise time, and you talk to the wise elder, and that's not our culture, or at least in America.
Just wait, that was us. Black culture. What does that even mean?
The change.
Like, that's what I took it as, you're evil. Like, I get so angry all the time.
Yeah.
I was like, that's a change to me. Nobody talking about vagina or libido, the weight gain.
So,
my arms and legs. You know what I mean?
So let's talk about the sex part. Okay, so there's this study I want to tell you about. So people can have the best sex of their lives after menopause.
Let it come.
Yes. Really? Okay. Because, and I've got a question for y'all in a second, but okay, there's this study. They interviewed a bunch of couples that were together at least 25 years. They were over 60, and they self-reported having great sex. Okay, and the themes that stuck out were fun, having fun together, growing together through life changes and self growth, and then coming together with that. Not goal oriented. So yeah, that's the main one, right? And so we'll talk a little more about that, but not goal oriented, meaning like orgasms aren't necessarily the goal. Erections, arousal at all isn't necessarily the goal, because you start putting these pressures on what sex is supposed to be or look like or feel like, especially based on some idea that culture's been telling us it's supposed to look like and be like, and so we've all just enacted for the first 50 years of our lives. And it can't be that anymore for a lot of people. And so you take the pressure off what it's got to be, and all of a sudden then maybe you are aroused, right? Because you're not supposed to be. So yeah, I know that's kind of a crazy thing, but not even erections necessarily. Okay. Yeah, I know. Well, yes, you do, because while we're on the topic, this is this is a vulva that I have in my room at work. I don't know if y'all have ever noticed this. Yes, of course you've seen it. So here's the clitoris, right? This is from the external view, there's the urethra, there's the vagina. But I don't know how many of you know this, and this is going to get really uncomfortable. If I can see your face, you're like, no. Okay, good. Yeah, we're going to talk all about kind of crazy stuff. So this is actually the clitoris. Yes. Oh, I love that y'all making this face. Yeah, people have earrings. Yeah. Look on my. I should wear those.
You better send that in and get that's what you're gonna be selling in your office.
No, I've met a lot of people with earrings like this, actually.
That was it, clitoris.
Yep.
And only you would know what it was.
Yeah. And some other people, oh, they'd be like, yeah. So it does all this stuff, and here's the cool thing about it is a penis. You know, there's urine that comes out of there. There's semen that comes out of it. The clitoris does nothing but provide pleasure. There is nothing that this does but provide pleasure. And there are 4 times, I believe is the number, more nerve endings. No, it's way more than that. Way more nerve endings in the clitoris than there is in the penis, too. And here's another fun fact while we're talking about this. So, I'm going to ask y'all what is sex here in a second. And I just want to tell you that 4 to 20% of people with vulvas can have an orgasm with penetration alone. The data is kind of all over the place. 4, some people say percent, some people say 20% can have orgasm with penetration alone. Most people need clitoral stimulation, right? And they think that even those 4 to 20% who can have, I'm having a hard time saying this, orgasms with penetration alone, they think it's because the space between this and this is shorter. So then you've got the penis going in. This is obviously the back, but I'm trying to do it so y'all can see. Actually, I can just do it like this. The penis is closer. Like if that's short, it's closer to that, right? So you're actually stimulating the clitoris. Anyway, so this whole like rhetoric of, you know, the baseball games, first base, second base, third base, home, and home is like vaginal penetration, and there's an orgasm, and it's usually the male, especially at the beginning. Like, you know, once you're in a relationship for a long time these days, luckily most women are saying something like, what about me? But even so, even the youngsters these days, those first hookups, often it's the guy only that has an orgasm, and then that's supposed to be the end of sex, right? Yeah. So most of us can't have orgasms that way, FYI. Anyway, not that that's the goal anymore. But if it's not necessarily happening, there's just so much other stuff that we can do that's fun. So I want to know if anyone's interested in telling me what you think sex is.
You put the what is that song? You put the thought in the coconut.
Put the lime and the coconut and mix it all together, right?
The lime and the coconut.
And mix it all together.
Stop it.
Okay.
Sex is penetration.
Okay.
The male finition. In my life right now, I'm like,
okay.
Because it's
Yeah.
I could care less.
But was it that way always?
Oh no.
No. Okay. 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 Was sex that always though?
No.
Okay. Not necessarily with him only, but I mean, like, was sex penis and vagina?
No.
Okay. Lovely. Okay.
And now that's all.
That's all it is. Okay.
You think sex? Yeah. However you get it, it's the orgasm.
Okay.
If you reach orgasm, then you're right. I mean, we're both supposed to be partners, but like she said, it doesn't always happen, right?
Yeah.
But orgasm, but you don't get orgasm at all. Are you having sex? Obviously goes the motion of having sex, but sometimes women don't orgasm, or the man first. Sometimes the man doesn't, and the man wants to take forever. I already did mine, you still going on, and it's like, yeah, different timing, but orgasm ultimately.
So any way you get it, or an orgasm is sex? Is it sex when you give yourself an orgasm?
That can be too, of course.
Okay. Okay.
Yeah.
Okay. Okay. So sex can be if an orgasm is involved, it's probably sex. Okay. There's no right answer. Really. No, this is it. No. It it's just interesting to talk about what we think sex is because we don't talk about it. And you don't all have to answer either. Like, don't feel pressured.
As far as like 16-year-old girls, that's effective.
Yeah. Yeah.
I do.
Yes. Penetration. Yeah, right. Well, babies. That's, yeah, potential for babies and STIs. Okay. Anyone else want to share?
I mean, I feel like I've been trying to change my definition of sex. Like, I feel like I've always thought it was like, yeah, not necessarily penetration, be like, other types of joint pleasure. But definitely always feeling like orgasm needs to be part of it. And I have just read and heard really inspiring perspectives of trying to even take that away. So like it doesn't have to penetrate. Like moving away from penetration is like one step, but moving further, I'm like, how am I going to be okay with that having an orgasm? I don't get it. So real curious. If you're going to tell us how to do that.
Anyone else?
Can you have sex without orgasm?
I mean, what is sex? That's the whole question. Okay, do you want me to tell you what I think? Okay. So sex can be, and this is where it gets a little tricky because if we're talking about, anyway, you don't need to go there. Sex can be phone sex. You can have sex over the phone. You can have the sex with someone who's not physically with you. Are you? That's the thing. Well, what if you're okay? So
Really like turned on and not orgasming and having a very like satisfactory like
exactly. Yeah. Well, so here's the thing. Yes. Okay. So you can think of a time, maybe a long time ago, when you were with somebody and you were in a space where you're not allowed to actually you feel the tingly, you might be talking. Yes, you might get aroused. I mean, that's.
I can't take myself there.
Well, okay, I have a thought on that too. But so those things, like maybe you're touching, maybe you're kissing, but you're not able to go get naked in another room. So you're not even necessarily touching each other's genitals, or maybe you are, but it's just outside of clothes. But like, that's still sex. I mean, it's not penetration, but it's still like you're thinking about it. So, and it's super hot. It can be so hot. Like, think of the hottest times the peak arousal you've ever had in your life. This is a good one, actually. I'm pointing to you because I learned this after we worked together. But think of the times in your life where you were most aroused and what the situation was and how to take little pieces of that and incorporate that into your current situation in order to feel a semblance of that of being aroused again,
What if you get arrested?
Well, yeah, what? Because you're in the woods? No, exactly. Find some woods that are a little bit more, far away from people.
And she said, remember a time when
On an airplane? All right. Well, they're not going to arrest you. I mean, I don't know. They might. They might. I don't know. You might get arrested, okay? But that's part of the fun. That's the whole thing. Exactly. It's risky. Exactly. Yeah.
No matter what's happening.
No, if you're menopausal, they'll be like, oh, okay, so proud of you, like that y'all are having sex wherever you want to do. I mean, that's amazing. But that's a really good one because actually the things that are generally most arousing for the general public are taboo, things that aren't allowed, right? Which is why if you're not allowed to have sex with someone yet, which is why a lot of our peak arousal experiences were when we were younger, because if we're not allowed to have penetration, with somebody or don't feel like we're allowed to, if it's society telling us or our parents, our religion, whatever, you're doing all this other stuff and it's so hot. So why can't we do that with our partners? Like, make out with them, make a rule, or we cannot take off our clothes and we like get all up on each other and dry hump, you know? Like, that is fun, you know? That's what I said. You're all thinking, see, your faces, like you're getting lit up because you know that this is actually right. Yeah. Anyway, so that's what is sex. It's like all of that stuff. So it doesn't have to be an orgasm necessarily, because the other stuff might even be better. The yeah, and if the orgasm's difficult for a lot of people, it becomes harder as through menopause or for other reasons, or there's pain maybe with the penetrative part. Like, that stuff becomes the opposite of arousing because it's not. It is, pain for most people. They don't want that. So if you can take that off the table, just play with taking different levels of things off the table, whether it's penetration or whether it's keeping clothes on or whether it's orgasms, and see what happens. Just to experiment with it, to play with it. Play. Okay. Also, pleasure. Bless you. So let's talk about pleasure, because feeling numb, like all this self-sensing, and I know you're probably meaning emotionally numb, probably more, right? Just because of everything. But that can manifest in our bodies too, or one can be related at least to the other. So taking time, there was a period in my life when I felt numb, and someone said this to me, and it was really huge. So I wrote on my calendar every day, so I would just see it. Notice pleasure. I think I told you this too. Notice pleasure. What does that mean? Because pleasure is like, oh, that feels good. Pleasure is orgasms. But pleasure is also, for me, when I'm taking a walk, or I might see the light coming in through the leaves in a particular way, and you can just see that and move on and not pay attention, because we have so many stimuli coming in our awareness at all times with all the senses: sight, smell, taste, touch, sound. There's so much going on. So can you, if you take even a second, an instant, and there's something pleasurable, maybe the wind on your skin or the leaves, the sun coming in through the leaves, maybe it's a song that you hear, like, instead of just like moving on, phone, Instagram, whatever, stopping yourself and noticing that and feeling the pleasure. Maybe it's while you're washing your hands, like you're washing your hands. Mindful hand washing, it's called. It's like, that actually kind of feels good. Interesting. Washing your body, same thing. Shower. You do all those things so many times a day anyway, so can you do it mindfully? I just realized that we did not do the activity I wanted to do. Nope. We're not going to have time for it, but it's on here. So if that concept sounds like, oh, I need that, like I've forgotten how to feel pleasure in my body or feel anything at all, the Betty Martin hands, going to this website with the arrow, and this is a list of resources. Y'all can take a picture before you leave. I'll talk about most of those things, but that hands one is really, really kind of profound and simple. Yeah. All right, so now this is where I'm gonna need y'all to tell me. So I want to know, because I keep touching the damn thing. I know. I guess I touch my chest a lot. As a pelvic floor PT, we can talk about. I mean, obviously, pain comes up a lot, right? So the physical, if we're gonna have penetration, like, there's a lot I can tell you about how to make it better. There's the emotional kind of sexual side of all the things that we need for arousal and lubrication after menopause or peri-menopause or in general. And then there's the physical part, like the blood flow issues. There's pain. What do I do? So I kind of want to know if y'all are open to it. Maybe everyone close your eyes. And if you have pain with penetration, raise your hand. Okay, you can put your hands down and open your eyes. Okay, so we'll go into the parts of it first, and then I'm gonna. I could just talk about this for like 2 more hours. That's why I'm trying to figure out what to focus on mostly. Okay, if sex is painful, let's talk about the things that are going to be generalized for everybody first. How to like get more turned on first before you have penetration. The things we talked about already, dry humping. I'm gonna say that for you. Sorry. Yeah, take a step back, take things off the table, experiment with it. This, I'm gonna let y'all take a picture. This is my supervisor. She's a pelvic floor PT and a sexuality counselor, and she put this together. So I thank her for that. That's why we're gonna keep her name on here. But sensory play, this game is amazing, okay? Because it brings in all of these little pieces that kind of help your sex life. So the concept is, but it's fun and it's not scary. Most people can kind of get behind it. So this is with a partner. It can be more than one partner depending on your situation. But if there's 2 of you, each person chooses 5 objects from around the house that you. So say it's me. I'm choosing 5 objects from around the house that I want to use on my partner without genitals to start with. Take the genitals off the table, okay? And then I have 15 minutes. I'll present those objects to my partner, and he will say, you can use this, but not that. You can use this, but not in this way. So then he gives his consent and his ideas about what will be good for him in that way. And then I use those objects on him for 15 minutes in a sensory way. Like, how does this feel? And the goal isn't necessarily to arouse them, but it's likely going to happen just because it's wild. Okay, so I have those 5 objects. I use them on him, and then he gets 5 objects. He uses them on me. Separate time or the same time, I get 5 objects that I want him to use on me. So this changes the dynamic because I am now asking for what I want, and it's about my pleasure. Oh, that's one more thing. When I have the 5 objects that I'm going to use on him, it's about my pleasure. So it's not I'm choosing something that I think he's going to like. I'm choosing what I want to use on him. Mm-hmm. Okay, so this is where we get this kind of give and take of who's getting the pleasure. And it's a little bit of a role play and also like a dominant submissive sort of thing, but in a very subtle, easy to digest way. It's fun. Okay, so my objects, I'm using them on him for my pleasure. He's got his objects, using them on me for his pleasure. And then I get 5 objects I want him to use on me for my pleasure. And the opposite.
We're talking about 15,
15 each.
I
I know, but hey, this doesn't, not all in one set. Like this can be, you do 15, you do maybe only 2 of those parts. So on here, there's like an option 1 and an option 2. It kind of depends on what feels like the thing that you want. So that's 30 minutes total.
Do men deal with this pleasure?
Say what?
Do men deal with this pleasure thing?
The like having pleasure?
Like not having pleasure, like
sometimes, not in the same way. Yeah. I mean, but they do, erectile difficulties are a real thing.
I don't know, that's another topic. I'm just trying to understand, like, why we always gotta be doing You know what I mean? It always seems like a lot.
Yeah,
like we're here trying to make ourselves better for the relationship.
Right.
To me, for them, it's very simple.
Yeah.
Yeah.
They don't have to put a whole lot.
And socially, that's what they're socialized to believe, is that they have an erection. So that's like spontaneous erection, quick penetration. It happens, relatively quickly, and then orgasm and it's done. Like that's what they're supposed to do. So it's not really ideal for them either, because that's like, sometimes 5 minutes of a thing of pleasure, when pleasure could actually be extended for, this is only 30. I know y'all are like, what? You do both at 60 an hour. People sometimes go have this little pleasure sessions for hours together, right?
But when you work with the clients, I know I brought my husband in. Do you normally you would work with them as a couple? You would only work with
well, because I've been in a setting at Texas Oncology, and as a physical therapist, I have to have one patient, and then I can have their partner, but it's like educational for their partner.
Yeah.
But when I go into my own thing, which I'm starting, and I can see couples, and it's not within there's no insurance doing anything, so I can do whatever. Yeah, there's no restrictions like that. So yeah, we could talk about both. But erectile difficulties are there for men at the age of 50% of the time they're going to have difficulties with erection. Age of 60% of the time. Age of 77% of the time.
I'm in menopause, maybe, I don't know, I don't think my husband has erectile, but I'm just saying, it would just be a good thing, we wouldn't have to worry about none of this.
If neither of you wanted it. But here's the thing, don't you remember those times? And sure, of course, if there's no motivation on either end and you don't care, then it is what it is. But when we're talking, sorry, I'm gonna say it one more time. When we're talking about dry humping, like you all remember that feeling, right? Of that joy and that kind of like losing your mind feeling, and that's similar to like wonder and vibrance and feeling alive and feeling like a woman and in your body, like all that stuff is related. So if it's just remember that's there. So that's kind of where like playing these games can maybe stimulate some of that again. And if that motivates you, then great. And if that doesn't motivate you and your partner's fine without it, then whatever. But
It's basically foreplay.
Exactly. I'm kind of trying to say like foreplay sex too. Yeah.
Even that by itself can blow you away, right?
Right.
Anticipated so much. That's the part that I miss from my young, because back in the day, I mean, the wind blows, I'm like, oh wow, because it's so sensitive down there, especially if you see someone you love or like, or whatever. But nowadays, it's
So spontaneous versus something I wanted to talk about. So thank you. Spontaneous versus responsive desire. When you're younger, usually, and for some people always, some people are always like never have spontaneous desire. Like you're talking about the wind blows, you're like, ooh. Some people never have that. But for those who did, many of them, most of them, it will change during menopause, where all of a sudden it's not spontaneously happening. But I'll give you a couple tips for how to make it happen more often. Responsive desire is very common after menopause, and it is also totally normal and just as workable and full of joy and pleasure. And that means like you need more foreplay, but all these things, or taking sex off the table, or doing any of these things we talked about, you basically need more stuff to get there. And that stuff to get there is actually can be the best part. It's like the journey versus the whatever. Yes, the journey is actually can be the best part. And here's the other thing too, like vibrators, all these toys, like they're for a lot of people after menopause, there's less blood flow. They talk about vaginal atrophy. I don't like that term. It's an old term, but the tissues do get more brittle. They get thinner, less self lubricant or lubricating, and that's because of less blood flow. Less estrogen leads to less blood flow. So there's less spontaneous desire because that comes from actually engorgement, blood flow. It's like all of a sudden, if you feel it out of the blue, I mean, it could be something stimulating you, but it also could just be your body. So it might be that you need more things like a vibrator, like like a toy to actually feel more things to have an orgasm if that's what you're trying to do. Also, there's all these other little tricks, and it might just be time to be like, partner, if you've got one, I'm gonna start reading erotica before we have our sexy time because that's gonna get me in the mood. And this is and this is just how it is. Our sexual penetration, whatever you want to call it. But yeah, like erotica can be it's mild enough to not offend most people. It can be pornography too, if that's okay for you. There's really, if you want to know some really good ethical sources of pornography. I've got some.
Did you give me some ethical sources that I gotta log in and put my email in there?
So here's the thing: these days, especially in Texas, like you can't watch porn because there's all this, or it's hard to watch pornography. So you even, I'm sure they're not looking at the ethical stuff either.
Yeah.
But usually the ethical stuff is you have to buy it because it's ethically made, which means something. Say that again.
How are you gonna ethically make some?
Well, ethically meaning like the people are all totally consenting of everything. There's, yeah, it's not like, yeah, they're paid well. They're paid well.
They got insurance, they have medical.
Yes, exactly.
Okay, that's another subject.
Not illegal.
It's not, yeah.
It's not illegal?
Well,
Okay.
That's,
I don't know
yeah,
much about it.
I know what you're talking about.
Yeah.
That ethically.
So you're saying that the ones,
Yeah.
because you did, I was looking at my notes, but they have to put my email in.
mm-hmm.
System is all up in my email.
Yeah,
You get spam stuff.
yeah.
So
But
I'm
probably
terrified.
not these, the ones that I'm telling you about. They're not going to spam you because they're just, it's like a, yeah, that's part of the ethical thing. Yeah. But anyway, we don't all have to go watch porn now. I mean,
Yeah.
another good source, if you're looking for something more mild, Anais Nin has great erotica, and it's Anais Nin, an author. She wrote, I think, from the 30s, 40s. She's an author. ANIAS NIN. She's French, I believe.
And NIN is the last.
And
Can
it's,
you send me an email though that I can, with the resources and I can send it out to everybody?
yes, yeah. I'll write down the.
And I can send it to them. Is that gonna be okay?
Yeah,
Send
yeah.
that through Eventbrite?
I don't know. Ask Eventbrite. So Anais Nin, and most of the resources are here too. But I'll send y'all some ethical porn sites. Yeah, y'all can take a picture of that. NIN. And there's a lot of other. Yeah, you can get her books. I'm sure she is.
There was some good erotica books that I got from. I used to read it all the time.
I probably she's.
I got it from the public library. Yeah. She's not over there. Yes.
Is she?
She was trying.
Erotica books.
Yeah.
I mean, I don't know if it's erotica, but romance, sexy romance, but it wasn't. It was good.
Well, Anais Nin, it's not like 50 Shades of Grey, which also is not actually accurate. Do they? Well, my point is Anais Nin is not that explicit. It's more. It won't make you. Most people wouldn't feel guilty reading it. I don't know.
I don't want to read.
Well, then you get yourself.
We need guilty pleasure.
Okay. Oh, I see what your kink is now. You like things you're not allowed to do. Okay. All right. Well, guess what? I'll send a couple other websites with different erotica too, because there's there's Literotica is another website.
You told me Literotica, but you have to sign up.
Okay.
You have to pay. I guess you have to pay.
I know. That is part of what makes it ethical, though, because then you pay, and then they get paid. That's the whole thing.
I paid for 1 month of one of those sites. I'm gonna get in there. I'm gonna do it.
1 month. Good job.
I was like, no, I just watched nothing.
Yeah, I know. That's the thing.
That's
the thing.
Can we ask about the atrophy? You don't use it, you lose it, kind of thing?
I don't know. Like, does that really mean like?
I didn't mean to nod.
Like, I mean, even just the regular aging, it doesn't mean if you don't use it, you're gonna lose it. I think you're gonna lose something, regardless if you're using it every day.
You're not going to lose it.
Right.
It just will take more time to get back to a place where it's more comfortable. If you stop, so say you're stopping penetration, and it's been a year. I've got tons of patients who come in. It's been a year, so yeah. Told me that you. Okay. Anyway.
But you would use the estradiol.
Okay.
Estradiol.
Okay. So here's what I would suggest. So yeah, you don't lose it forever, but it does take more work. So there, how to do the work. Estradiol cream. So for people who are dealing with breast cancer, Uh, so for metastatic, I know that for some metastatic cancers, it's still these days, the research is blowing up right now on this stuff. So estradiol is basically estrogen cream that goes on the vulva, and you put it all around the clitoris and inside if you can. And that is, many gynecologists, urologists are like pushing that as almost a preventative thing for people who are in perimenopause, even whose tissues are starting to change. And most cancers, there's some gynecological cancers that can't use it, but almost all the breast cancers can, even ER positive, because it's not really getting in the bloodstream. There are, so different oncologists will have different views on it, but most of them these days are allowing it. And it makes a huge difference. It's a prescription, yeah. So I would ask your oncologist, yeah.
The third version of estrogen, that's a step milder than estradiol. And I don't remember what it was called. It's like a E3 something.
Oh, yeah, but then they said no. I asked oncology if I can use it. I have notes, and she said no. She said no.
Yep.
It's because I know one of the men that's the sales rep for that. He says ask your oncologist for this. And I took notes, and she said no. If it's estrogen, she told me no.
So no to estradiol either.
No, I can use estradiol.
Yeah.
I use that. E3. Did you call E3?
Yeah, but I thought E3 was like less
A step away.
Than
That one, I'm not as familiar with that one. There's another one.
From oncology. I got it from OBGYN.
Yeah, and that's the thing, you would have to get it from, most of the time you have to get it from OBGYN, but the oncologist has
well, I
to.
tried estradiol.
It didn't do it?
I couldn't handle the ingredient. I reacted to it.
Cause, yeah.
Yeah, because I'm weird.
Well, you can also get it compound. You can get it compounded. Go to People's Pharmacy and ask for it to be made in the way that you can tolerate it. Just make sure that the dosage is correct, because you can overdose on it. And if in your situation, People's Pharmacies, they're good, but get very specifics from your gynecologist, oncologist person. Okay, so it's because of a lack of estrogen, the tissues change in the way that we talked about. They become more brittle, dry, and this is the way that I've seen, like the snowball effect that I've seen most often, is there's some shift. With breast cancer, it happens like that, so it's more obvious. If it's a slower thing over time, the tissues change, they become more brittle and more easily torn, like little micro tears can happen with penetration and friction and movement, and then that hurts, which then it's like, wait, that hurt, and it's my vagina, and there's more sensitivity and emotion around that than if you hurt your finger. So it hurts, and then the next time your body starts to guard a little, and then the muscles engage, and then the next time it guards more because it hurt more last time, and then it becomes like, so then your body sometimes doesn't let go at all, ever, of those muscles, and it can become a whole snowball. So the estrogen cream is helping to plump up the tissues again, to make them more, basically, so that they don't have these little micro tears in them. So it puts its localized estrogen right there where it's needed, but it doesn't get into your bloodstream. Other people, if that's not enough, and you can do HRT, or they call it menopause replacement therapy now, MRT, I think. That's a more systemic option. But if you don't have any other symptoms that are upsetting, like hot flashes like crazy, you can just do the vaginal estrogen and probably call it a day. You get more self-lubrication that way. Another thing, though, if you can't do the estrogen cream for whatever reason, you can use a lubricant. Okay, I was trying to get them to send me the one that I wanted y'all to have, but it didn't come in time. This is a water-based lubricant. On the resource list, you can go to, actually, y'all can take vaginal renewal program, and there's other course on there too. That's like a list of the things you could do when you're trying not to have penetration. And then make sure you take a picture of this game. But on this resource list, sexualityresources.com, they have a bunch of lubricants on there that are hybrid lubricants. Actually, in the vaginal renewal program, there's a list of them too. And y'all can take a sample of this lubricant too because it's good. So basically, you get your water, you get a hybrid lubricant. The water-based part is a moisturizer. The silicone part seals the moisture in. The lubricant, I would use it every day after a shower. So lubricant's not just for sex; it's a moisturizer. Okay.
Oh, like lotion on your legs.
Exactly. But these lubricants too, the ones that are written in here, they don't have any of the bad ingredients in them, so they're all really good for your body. And if you don't react,
Sorry.
I don't remember.
Okay.
You
I'm
can just
sorry,
sign
I
up
interrupted
again.
you. Go ahead.
No, it's okay. Anyway, this one is just a water-based, but Sutil has a hybrid too. This is a really good lubricant though. So you use it every day after a shower. Just put it all around the clitoral hood, inside, around the vulva. Yep.
On the thing,
Your model.
Well, it didn't really show the
And do you
hood.
do any of these ones that are recommended?
Yes, Oasis Silk is everyone's favorite.
Okay.
That one,
that's what you wanted them to send, but they just.
yeah,
I'm all about.
yeah.
No, I didn't. Thank you.
There's another one on there that a couple of patients have said they've reacted to over time with in a bad way, but I use that one and it's been fine. Anyway, Oasis Silk is the one that everyone loves. It's a hybrid and it's really not that expensive. It's like $20 and it lasts almost a year.
From like,
You can get it anywhere. You can get it on their website. You can get it on Amazon or whatever too. But around the clitoral hood means like under, there's like a, just like the penis has a foreskin, the clitoris has a hood, and it can start to adhere a little bit after menopause. So you want to get in there underneath it because that can make your sensation less intense.
Oh, okay. I have another question. I don't know if you're gonna be able to answer this. So I've read some places, I don't remember somewhere, but it's like you shouldn't like like they say don't use dish things all the time because that's like it just cleans itself. Like
Yeah.
you shouldn't like do a whole bunch of soaps and stuff even around that area too because it's
Right.
like is that
Yes,
right?
that's right. Yeah, you can mess with your
Because
pH balance and
okay, all right.
Yeah.
I'm just curious if that
yes,
was true.
that can be huge. Yeah. Yeah, that was actually so talking after I had my child, I was using a normal like a Dr. Bronner soap and a loofah. Now I laugh because of what I know, but I had this clitoral pain for years, all the time, itched and hurt. Like I would sit on my bike because I bike everywhere and it hurt all the time. I'd walk and it hurt. Yeah, not fun. I'd be like, don't touch me. And then I started finally, I got Basis soap, which is like $2 at HEB, which we love. And it's a bar soap. It's really mild. Use my fingers only to wash the vulva, never a thing, never a loofah, never a rag. So it makes little micro tears because that skin, it's like loofahing your eyelid, It's too tender. Yeah. Yeah. Good to know, right? Yeah. So you don't do that because it can cause little, especially if it menopausally. Yeah. And then you get little micro tears, more bacterial. There's more potential for bacteria to get in there. Actually, more of a chance of getting like UTIs and bacterial vaginosis and yeast infections. So I'm glad that you mentioned that.
Because I just remember when you you were showing us the model.
Yeah.
And you're like the hood, and I heard that you shouldn't be like just like scrubbing.
Yeah.
Like you don't need that kind of thing.
They actually said
Like
you're
that.
not really supposed to even use any soap at all.
Sometimes it stings. I mean, I love this soap, but there's moments where it's like, why is it stinging?
That's probably yeah.
So that's my pH level.
Not necessarily with the sting, but I would imagine if there's a sting, maybe there's a little tear. Yeah. So use your hands only, warm water, if that's what if you can do that, that's even better. But a little Basis soap, it's like a Basis is a cheap brand of soap that basically a scent-free, sensitive skin thing. Dove is another one, yeah. And you just use your hands, no thing. And then after a shower, your tissues are warm, you use your lubricant externally. And if you can tolerate a little bit internally, thank you. Well, the problem is I can't really get in there. Well, okay. All right, yeah. This is fun to know. This pelvic floor. Anyway, yeah, okay, that's a good question. So externally, all around the clitoris, the labia, so internal and external labia, and like the entrance of the vagina. All those tissues, lubricant. And then here's the thing for blood flow, to help with blood flow, especially if you can't use estradiol cream, or even if you can, get yourself a vibrator that's not super big and scary and painful. Did I bring
Is it the
that?
one you told me to get, that one that looks like a?
Yeah, the pelvic wand. I was thinking about bringing that, but it's too complicated because I would need to talk about it for another 30 minutes. But any vibrator that's thin, and insert it. So relaxing position. I want to teach you one.
You can do all this after a shower.
Okay, no, this is not after a shower. No. You're like, I got kids. No. After a shower is just lather some on real quick and you're good to go. Yeah. Yeah. This part is, I would say, with estrogen cream, estradiol, it's like 2 times a week. You're inserting it right before bed, and then it does its thing while you're laying down. So 2 times a week. If you can't use that, use a lubricant. Same thing. You're getting a vibrator, and you're like, and it talks about this on that vaginal renewal program. You're maybe just mobilizing that tissue right there at the entrance, like down, straight down, kind of like a perineal massage if you ever gave birth and did that. You're trying to bring blood flow that way with your fingers, and then you could use a small vibrator if you could insert it in a relaxed position, trying to soften the muscles as much as possible. And that vibration brings blood flow too. So you're starting to kind of get blood flow throughout the entrance and the whole vaginal canal.
How often again?
So 2 times a week should be enough.
Same time as the estradiol or opposite?
It can be at the same time. It could be a different time. It's okay either way. Here's one tidbit for anybody who's like, I hate that I say tidbit. It just comes out of my mouth. For anybody who has pain, okay, this is one